Okay, so I've been called to a 25-year-old female with essentially located abdominal pain with nausea and vomiting. I've just got my standard PPE on as I walk in the door, and the first thing I would do is look for dangers. I'm just in a normal house and there appears to be no danger, so I'm going to move on with my assessment. Hello, my name's Michael, I'm from New South Wales Ambulance. What's your name? How can I help?
Oh, my name's Sally. It's really hurting.
Okay.
I can hardly breathe properly.
Okay. Is it okay if I have a look and assess you and ask you some questions?
Oh, it's really sore. It's so sore.
Alright. When did this pain start?
I don't know. I've had it for a couple of hours.
Okay. And whereabouts is it exactly?
It's just in the centre. Right. It's sore.
Alright. How about I sort out your pain relief first, okay?
Yeah.
Okay, so I just need to do like your blood pressure and everything, and then I can sort that right out.
Yeah.
Okay?
Yeah.
So the first thing I'm going to do is I'm just going to mock it out. I'm just going to do blood pressure, heart rate, respiratory rate, SpO2, the sugar, the temperature, all the vital signs. The patient is GCS 15, and the vitals are as stated on the sheet. The first thing I'm going to do, because they're in quite a lot of pain, is just to sort out some pain relief. So, can you tell me how bad your pain is out of 10?
Oh, towards a 10.
Okay.
Definitely.
Alright. Are you allergic to any medications?
Not that I know of.
Not that you know of. Okay, great. What I'd like to do, I'd like to put a little needle in your arm somewhere, and that way I can sort out any medications I need to give you, okay? And I can sort out that pain relief right away. Is that okay?
Yeah.
Alright, so...
It's anything, I'm so much in pain.
Okay, we'll sort that out right now. Make you feel a whole lot better. So I'm going to cannulate, I'll do all that. The patient has stated that they're not allergic to anything. Have you ever had morphine before?
Yes, many years ago.
Okay, how did you cope? Did you have a reaction or was it okay?
It seemed alright, yeah, if I remember, yeah.
The patient has a strong blood pressure. I'm going to just give, they're in quite a lot of distress, so I'm just going to give 5 milligrams morphine IV straight away. Okay, now that we've sorted out some pain relief, I'm going to start doing the abdominal assessment. It's a lot better for me if I can start assessing you from the other side. So is it okay, if you can, to just flip yourself around on the other side of so your head's at the other side of the couch?
I think I can. I'm probably not as much pain, but...
Yeah, great. I'll give you a hand if you need.
Alright.
Take your time. That's it. And you can stand all the way up. Okay, great. I'm going to do the blood pressure on the right hand side. And there's no postural drop from before. And just to make sure, I'm going to do another blood pressure on the left hand side. And both blood pressures are the same bilaterally with no postural drop. So my general impression, so far so good, apart from the pain. The patient's not in any respiratory distress. They are pale and diaphoretic. However, there's no cyanosis, essentially well perfused. I'm just going to press on your chest if that's okay. And essentially the recovery field time is less than 2 seconds. In the environment at home, there was no other clues. There's no oxygen tanks, nebulizers, or any medications whatsoever. And there was no social red flags like excessive alcohol, drugs, smoking, drug paraphernalia, and anything like that. Lived in a nice plain place. I'm just going to have a quick look head to toe, just really quickly. So the patient is managing their own airway. They're breathing normally and talking to me. Let's have a little listen to your chest. I'm going to auscultate the chest, and then I can auscultate the back as well, and just have a listen to what the breath sounds like. It sounds nice and clear. They have a good SpO2, they're breathing at a normal rate with no increased effort. The trachea is midline, I'm happy with B. Next, we've got a bit of circulation. I'm just going to feel both pulses. And I'm going to feel for cross. And I can do this over a 30-second period, everything feels good. I'm going to feel also the pedal pulses. Everything seems good. The next thing I'd like to do is, with the LifePack 15, is just do an ECG. This means I can put some electrodes across your chest and on your arms and legs. That way I can see what your heart is doing. Because sometimes you can get pain in your belly when it's actually a cardiac problem. So I just want to make sure that you're not having any problems with your heart. Is that okay if I check it out?
Yeah, but I'm feeling a bit sick.
You're feeling a bit sick?
Yes.
Okay. Did you say, and you said before you had no medication allergies?
No.
Okay, with my partner I'm going to check the right route, the right dose, the right time, patient, drug.
Right.
Okay. No allergies, right? And there's no contraindications to ondansetron. You're not taking buprenorphine concurrently.
No.
And you have no allergies. Okay. Here's 4 milligrams of ondansetron that I've cross-checked with my partner. Okay. The IV, and I'm just going to take a note of that time as well. I can use a bit of a clinical leadership at this point to my partner, if they could start documenting everything that I'm doing, the vital signs and the timings of the medications. Alright, so moving on, I'm going to do the 12 lead ECG. I'll pop all that on, I'll print it out. It looks like a normal sinus rhythm. And this way I've got my patient on the monitoring as well, which is very helpful. Do you need more pain relief before I move on? How's your pain now out of 10?
No, it's probably around 5.
A 5, okay.
Yeah.
So that morphine's helped a fair bit. But how about I give you a bit more? You're still looking like you're in a fair bit of pain.
A little bit of pain, yes.
So I'm just going to recheck the blood pressure, redo the sort of vitals, and give you some more pain relief. I'm going to give another 5 milligrams of morphine and check that time. I'm cross-checking with my partner. Okay, so now that we've got your nausea under control and your pain a bit more under control, let's have a little investigation as to what's causing your abdominal pain. So what time exactly did this start?
I woke up and I think it was around 5, and I was just in pain. And
did the pain wake you up from sleep?
Yeah, straight away.
Okay, so it woke you up at about 5 a.m. And was it like very sudden, or was it just a gradual experience?
Very sudden, just woke me up.
Okay. And does anything make that pain better or worse?
No, I went to the toilet, but I thought that might help, but it didn't.
By going to the toilet, do you mean you did a wee or a poo?
Oh, I done a poo.
Okay, and what did the poo look like? Was it normal? Was it diarrhea? What did it look like?
Normal.
Did you notice any blood in the toilet bowl?
No.
Or on the paper?
No.
And it wasn't, you said it was normal, so
Normal.
like a normal consistency, not runny or really hard?
No, normal.
Okay. And after you opened your bowels, did you notice that affected your pain at all? Did that make it better or worse?
No, just the same. I thought it was going to help, but it didn't.
Okay, so it stayed
It's really painful.
So did it stay at about a 10 out of 10 after that bowel motion?
Really
Alright.
same.
And do you think you just passed a little bit of stool, or was it quite a lot?
No, it's just normal.
Just normal.
Just
Okay.
normal.
And have you had any vomiting?
Yep. Yeah, I've had vomiting.
Okay.
Yeah.
Could I have a look at it? Where is it?
I vomited into the toilet.
Alright. I'm going to get my partner to go have a quick look at that. And I'm going to get a vomit bag handy as well. And my partner's come back with that information, and it just looks like a normal vomit of normal stomach contents with no evidence of hematemesis. How would you describe that pain?
Oh, just really sharp.
Really sharp, okay.
Yeah.
And you're guarding right there where your stomach is.
That's where it hurts.
Does it move anywhere else?
It moves to the right of it, down the side, the shooting.
Up the top right area and in the middle, okay. And it's 5:30 now, so it's been half an hour. You've opened your bowels, you've had some pain relief. would you say the pain is getting better or worse or staying the same?
It's a little bit better, but it's still painful.
Okay.
It's very painful.
What would you give the pain now out of 10?
Probably a 7 or 8.
Okay, cool. Alright, well
Still very painful.
Okay, so we're just checking the morphine regime. We'll do our blood pressure and our vital signs again. There's 5 minutes between each dose. We're following our protocols appropriately. We're cross-checking with our partner. Our patient's still in significant pain, so I'm going to give another 5 milligrams of morphine. So Sally, I'm going to ask you a bunch more questions about what's happening today. Have you ever had or experienced something similar to this in the past?
Nothing.
Okay. And what's your medical history like?
It's good. There's never been an issue.
No issues that you don't take any medications or go to see a doctor for any reason?
Nothing.
Nothing?
No.
Do you see your doctor like just for checkups now and then, blood tests and all that?
Yes, the usual.
Okay. And you're up to date with your immunisations?
Yeah.
Okay. So you don't have any medical history, you don't take any medications?
Nothing.
What about your family? Are both your parents still alive?
Yep.
Okay, and what's their medical history like?
They're fine. Yes, theirs is good as well.
No problems with their belly or their heart or anything like that?
Nothing.
Okay. What about drinking alcohol? Do you drink alcohol?
1 or 2 drinks a night.
Okay.
That's all.
Okay, so nothing major there. What about taking drugs?
No
Do
drugs.
you take any drugs? No? Okay.
No drugs.
And socially, you live in this flat in the eastern suburbs of Sydney. Are you working at the moment?
Yes, I'm working full time.
Full time.
Yeah.
All right. And what's your diet like?
It's a healthy diet.
Okay.
Yes, I don't eat too much fatty foods or anything.
Okay. Sounds like you take care of yourself, and just my global impression, you seem to be in relatively okay shape. Would there be any sort of trauma that would have caused this pain, like going to the gym or playing sport, or?
No, I don't think so.
Okay. So it sounds like your physical health is in rather good condition, apart from right now, of course. And we'll get that sorted out pronto. What about your mental health? Is there any problems with your mental health?
No, it's all good.
Okay. You don't see a psychiatrist or anything like that?
No.
Okay. And you said you didn't take any medications or any like antipsychotics, antidepressants,
No.
anything like that?
Nothing.
Okay. How's your pain going now?
Yeah, it's
Out of
going
10?
up and down again, but it's probably up.
So it's kind of coming and going in waves?
Yeah, it is.
Okay. And what would it be now?
It's probably a 8.
An 8. Okay. I'll do the same things before. I've done it between each morphine, cross-checking with my partner, vital signs. We're coping well, hemodynamically and breathing-wise. I've got my oxygen ready to go if I need. But now we are sort of getting aware that we've given a fair bit of morphine. So I'm going to give another 5. So she's had 20 milligrams of IV morphine total. Is still in significant pain, looking pale, diaphoretic, basically looking the same as when I first got there. So that's... well, Sally, one of the most common causes of abdominal pain can be gastroenteritis. And you live here with your partner who's on scene. Did they have the same dinner as you?
Yeah, they did.
Okay, what was that? Yes?
Fish and salad.
Okay, and was the fish properly cooked?
Yeah, it was a grilled fish. It seemed to be cooked properly.
Yeah, do. And the partners had this, and they have no complaints with GI pain or anything as well. And how's your appetite prior to this as well? Had you been eating like 3 meals a day, eating good food each day?
Very normal.
And your fluids, how much fluid would you have on a normal day?
I have about I don't know, a litre to 2 litres.
Okay. And what about going to do a wee? Have you had any like stinging or burning during a wee?
No.
Or any pain associated, increased frequency, urgency, anything like that?
No.
And you haven't seen any blood when you do any, like pass urine?
No blood, but I don't look all the time.
Okay. Can I see your mouth? If you open up your mouth nice and wide, and just put your tongue to the roof of your mouth. And the patient appears orally, the oral mucosa is well hydrated and no problems with the dentistry. So since dinner last night, so what time exactly was that?
That was about 7:38.
7:30 or 8 p.m.
Yeah.
Okay. And do you feel like acid in your stomach? Have you ever had like heartburn or reflux, where that acid in your stomach is sort of rising into your chest and your mouth?
I have, yeah.
Does that maybe feel a bit like this or no?
No.
Okay. And prior to this today, you said you opened your bowels at 5 a.m. this morning. Had you been constipated?
Not that I'm aware of. Not that I'm aware of.
So would you open your bowels each day or every other day, or what would your normal bowel habits be like?
Every day, at least once a day.
And have you been farting? I know it's a bit of an embarrassing question. I'm just trying to figure out if there's any blockage or not.
No, I haven't been farting. No.
You haven't been farting?
No.
Farting's normal. Farting's normal. So nothing. So if you haven't farted, that's very abnormal, and that could be a cause of lots of problems. Did the sweating just start with the pain, or?
Yeah, with pain, like or close to.
Have you felt feverish, or have like a known infection that's happening at the moment?
No, not that I know of.
No.
Nothing.
Okay. And you said you don't take any medications or any prescribed medications, but would you take things like ibuprofen or aspirin on a semi-regular basis?
No, just normal.
Okay. How often would you take something like that?
Monthly, a couple of times a month.
Okay. Would that be associated with your period, or?
Yep.
Okay. So it's not like you're taking it a couple times a week. It might just be like 1 or 2 times a month.
Yeah.
Is that right?
Yeah.
Is that fair to say? Okay. Is it okay if I ask about your menstrual cycle? Is that okay?
Yeah.
What's happening with your menstrual cycle?
It's all normal. It seems normal.
Okay. Would it be regular, or?
Yeah, regular.
Is there a lot of blood, or is it?
Just regular. Just
normal?
Normal, yeah.
Okay. Would you have anything like pelvic inflammatory disease, or endometriosis, or polycystic ovarian cysts, or?
No, it's all clear.
No. And you said you went to the doctor and you get checked up, and so far so good. Right?
Yeah, okay, annually.
The social history is relevant here, as we're in a same-sex relationship. However, I'll still ask, is there any chance of pregnancy?
No.
When was your last period? How long ago?
2 weeks ago.
2 weeks ago, okay. And was that on time?
Yeah.
Okay. Have you ever been pregnant before?
No.
No? Or any miscarriages, anything like that?
No.
No, okay. So there's no sexual history, no menstrual history. So all good. The patient's still saying they're in lots of pain. We go through the same thing again. Then we're cross-checking, doing our vital signs. We've had 25 milligrams of morphine IV. It hasn't been very effective. I'm going to switch it up and go to fentanyl. So once again, no allergies. There's no epistaxis or any sort of blockage with rhinitis or anything with your nose. Then I'm going to give intranasal fentanyl 2 at 40 mics, check it from the partner. Then I'm spraying it up the nose. So I'm going to give this other medication. It's called fentanyl. This one is like a synthetic opiate, similar to morphine, but it's a bit stronger. And it works a little bit differently. It goes up your nose instead of up your vein in your arm. Would you like? Is that okay if I try this other one? Just because the morphine hasn't been very effective.
Oh, anything I need the pain relief.
Okay. Well, hopefully this one works. So yeah, I've decided to continue my assessment en route to hospital, and because we're still in significant pain, the patient's still saying it's somewhere between an 8 and a 10 pain score. I'm going to pre-notify the hospital that I'm coming, and I'm just going to continue the rest of my assessment en route. So we've loaded the patient into the ambulance now, and we're on the way to hospital, and we've got the intensive care paramedic here with me helping me out. Cool. The patient, I just did a quick postural blood pressure again before we extricate, and there was no significant drop in systolic blood pressure, no tachycardia. The patient was able to ambulate with some assistance between myself and my partner. So at this point I am not suspecting a GI bleed, as there's no evidence of erythematous melena, there's no discoloration of the stool or the vomit, and hemodynamically stable, and there's no pruritus or itching, so I'm not suspecting cholestatic liver disease, or there's no problems with drinking or anything like that. And there seems to be no reflux or burning, despite it being epigastric pain, it's sort of sharp and still radiating. We do take NSAIDs, but just once or twice a month, so definitely ulcers could be a potential. So Sally, I'm just going to have a look at your hands and your mouth and a few other things, just to see if I can find anything wrong. Is that okay?
Yeah, that's all right.
So if you can just have your hands in my hands, and hold your hands the other way as well.
Yep.
And I'm looking for palmar erythema, Dupuytren's contraction, or the asterisk is hand flap, suggestive of hepatic encephalopathy. And nothing is there. There's no nail clubbing or tobacco signs. There's if you hold your hands out straight for me, there's no tremor. And if you give them a big squeeze, my hand's a big squeeze, and bilateral, they're strong and equal, with strong regular radial pulses. And I'm just going to have a look at your arms on both sides. There's no evidence of muscle wasting or IBDU, drug use or scratch marks or bruises or domestic violence. The face appears, there's no jaundice or cyanosis. I'll have a look under your eyes on both sides, and there's no spider nevi or corneal arcus, xanthosina, anemia. And then I have a feel of your neck, and I can't feel any swollen lymph nodes or glands. So just my general inspection, the abdomen and the thorax. I can't see any scars or surgical scars. The patient denied keyhole surgery or anything like that. There's no obvious swelling. There is guarding to the spot with pain. I can't see any distended veins. There's no bruising or redness or contusions that I can see. No evidence of hernias Then I look as well, umbilical, adrenal. The umbilicus seems normal, it's not distended. There's no stoma bags or catheters in situ, and the umbilicus is even or flat with the symphysis pubis. And there's no spider nevi, which would be, it could be idiopathic or problem with liver disease or metabolism. But I'm just going to see if there's any bowel sounds. Is that okay?
Yep.
So I'm using my stethoscope, and I'm going to listen for 2 minutes just to the right of the umbilicus. And over a 2-minute period, I hear reduced sounds. I only hear one sound over that 2-minute period. And then I'm going to listen above the umbilicus. I'm listening for arterial bruits indicating AAA or arterial stenosis. I'm listening to what I hear, and I can't hear anything at all above there over a 2-minute period. So now I've inspected and auscultated, I can palpate. So I do it in this order so I don't disturb what's happening in the abdomen. And I'm just making sure as well with the pain and everything as well, having a good look at the patient while I'm doing my assessment. So this will involve me touching the abdomen and pressing down on it. I know you've got a lot of pain, but we seem to have sorted that out somewhat, at least as much as we can with our pain relief and our positioning. But maybe I can find something important. So who's important I can do this? Is that okay?
That's okay.
If it hurts, just tell me to stop. It's fine. So I'll start off light and then it'll get deeper. I'm going to start off up here first where it's away from your pain. Is it hurting where I press?
Seems alright.
And if I press a bit harder,
That seems alright.
and I'm just looking at your face the whole time to see what it's doing. And over here I know this is where your pain is.
Yep.
I'm going to press tender when I press in or when I let go?
You press in.
When I press in, okay. And on your bladder.
That's fine.
And I don't really have a feel of your kidneys, and pull out your kidneys.
Yep.
In, breathe in and out. And I'm looking for signs of pyelonephritis or large kidneys or splenomegaly, organomegaly. And over the side, in and out. And I can't block the kidneys, which is a good thing. Feeling for your liver as well, in and out. And I can't feel the point of the liver. There's no evidence of organomegaly or anything like that. I went out of feel as well. I couldn't feel any obvious rigidity or distension. Abdomen was soft and non-tender in other regions, just the epigastric and right hypochondriac. Alright, I'm on your right side. I'm just going to have a look at your JVP.
Yeah.
And if you take a big breath in and out. And I'm going to press in on your belly as you do that as well. In and out. And there's no elevation in the JVP nor Kussmaul's sign, which would be indicative of right heart failure. So my main differential, it has been quite vague throughout the whole history, and nothing sort of major has been found. However, I didn't hear any bowel sounds, both to the right of the umbilical or above the umbilical. So despite starting opening her bowels immediately when the pain began, and saying that she has farted once, probably my main concern would be that there is a bowel obstruction, twisted bowel, an ischemic bowel, would be concerned about that. There's a few red flags in that it's starting so suddenly. It woke her up. There's a sudden onset, woken her up from sleep, and also that she just looks like she's in a lot of pain the whole time. Pale, sweaty, diaphoretic. Yeah, so I've pre-notified the hospital that we're coming in with what might be an acute abdomen requiring surgery. I'm just going to ask Sally once more and take notes of vitals before we jump to the hospital. And I'm going to hand over my Miss Ambo to the hospital. Nice to meet you, Sally. I hope I made you feel a little bit better on the way. And take care. Cheers.
Thank you.